So I'm quickly just going to touch on the importance of early learning and childcare. Of course, I'm preaching to the converted here. Very briefly talk about a few pieces of the Canada-wide policy and agreements, and then I'm going to look or share with you some pieces of data where we've looked at what data that we already have, where we can try and anticipate how things are going to play out and maybe raise some warning flags about what might happen to low-income, disadvantaged children and families in particular, and then where we've gone to the agreements to see whether they have anything in place already that might try and mitigate some of that, and then quickly talk about some implications. So we all know that children can benefit from early learning and childcare and a range of outcomes. We know from the research that these effects are particularly strong for low-income children and families. Unfortunately, we also know that kids that come from those sorts of families are the least likely to be in high-quality care and care of the quality that they need. This is some data from the City of Toronto that Peter Ramuza was able to pull together for this talk. Along the x-axis on the bottom, we've got neighborhood disadvantage. So as we go from left to right, it's neighborhoods where demographic characteristics are more challenging for families, lower income, less educated. Along the y-axis, we've got the number of children per childcare space. That red line is what we consider to be childcare deserts, where there's a real shortage of spaces per child. And what you see with that diagonal line is that as neighborhood disadvantage increases, the number of childcare spaces decreases. So there are less spaces for neighborhoods that are disadvantaged. And we know from some of the data we've worked with that those families in those disadvantaged families have to travel further to get to childcare, and they're the ones for whom that's hardest, of course, because they don't have cars. Those areas also are less well served by public transportation. And this all leads to my next point, which is that we know that advantage begets advantage, and conversely, disadvantage begets disadvantage. The rich get richer, the poor get poorer, and we see that with access to services across the board. That's in the research, and I think it's permeated beyond research, is known as the Matthew effect. And just to illustrate that, if you've got low-income families and high-income families, as you do it see up there, we know that they're going to sort differently into different quality services. So more high-income kids are going to end up in center care. More low-income kids are going to end up in home child care, which can be wonderful, but on the whole has been found to be of lower quality. And perhaps even more worryingly, end up in no care at all. And this is exactly what we saw happen in Quebec. So when Quebec radically reduced the cost of childcare for families, we saw this kind of sorting, where the more advantaged kids from more advantaged families ended up in higher quality services. So we can anticipate that's going to happen as the Canada-wide early learning and childcare agreements are implemented. We know that a major goal of those agreements is to dramatically decrease the cost of families, and that's already happening, which of course is wonderful, but it's also going to likely play out in the way that I just mapped out. And it's going to get worse because demand is going to increase dramatically because it's now so much more affordable. So the objectives of the Canada-wide agreements, there's a number of them: affordability, quality, inclusivity, accessibility, and administration. The ones that I'm going to focus on in the 4 minutes I have to talk today are affordability and inclusivity, because that's where funding for low-income families might be embedded. Right? Those are the places where we might be able to track what the government has in mind, and the governments, of course we're talking about provinces and territories, not just the feds, around what their plans are for managing the needs of disadvantaged families. So the next thing I'm going to talk you through is some data that we have, and courtesy of the City of Toronto, largely both in terms of sharing data, but also in terms of funding data collection that we've done around families that receive the child care subsidy. So we're trying to use what we know about exactly that target population that people like me and yourselves are worried about, that we can use to extrapolate how things might play out under this new situation. So just to give you a little bit of background, to qualify for childcare subsidy in Toronto, it's really tricky because it's done differently all over the country. But in Toronto, parents need to be low income, so there's a sliding scale as to how much families pay. But if you look at how much they actually pay, it's close to nothing. Mostly by our standards in society, we agree that these families should qualify, can afford to basically pay virtually nothing for childcare. There's also an activity requirement, which means that parents need to either work or be at school, with some caveats for families in distress or families with low-income children, special needs children, but they basically need to be working or at school for the most part. Which means that as soon as a parent goes on parental leave or has to care for an ailing parent or loses their job, or I shouldn't say as soon, after a very short period of time, that parent loses their subsidy, which means this child is yanked out of childcare, and we all know how hard it is to get childcare again. So even when that circumstance is resolved, the likelihood that that child will end up back in the center where they were originally is, close to nil. So what this policy does inadvertently is cause instability for children. And we know from research in general and from some results I'll show you briefly that that is bad for kids. The other piece of this is that the current subsidy arrangements leave out a lot of kids, and they leave out these low-income kids, disadvantaged kids that we know can benefit most from access to high-quality care. So the data that I was alluding to earlier, we call the Child Care Matters study. It was collected in partnership with the City of Toronto and funded largely by the City of Toronto. And at the time that we started, which is a number of years ago, we recruited almost 900 families from the subsidy wait list. So these were all low-income families. When we recruited them, the average household income was in the range of $27,000 a year for families living in Toronto with children, so incomes were quite low. And we've been following these families since the kids were between 3 and 8 months of age. And at the time that these families entered the child care subsidy system, once they got a subsidy in space, they paid an average of $3 a day for childcare. So much less than that $10 a day, which I really want to highlight because it means that these families, if they have to pay $10 a day, they're going to be severely disadvantaged. So they still need the subsidies. Everybody's getting subsidized now if they are lucky enough to have space, but these families need additional subsidy beyond the $10 a day. This is just a little bit of a sidetrack, but when we look at our own data, we see that the families that got a subsidy, their earnings have gone up substantially more than the general population in Toronto of families with children. So the subsidies seem to be doing what we all want them to do, which is enabling these people to increase their earnings, make a better life for themselves and for their children. I want to just quickly walk you through some data around the instability issue that I raised. So we have tracked the childcare arrangement that these kids have, and what you see is that most of the kids, that 50 or so percent, they have the kind of stability that we hope for them. They start off at home, then they move to a center, and then they move classes within that center, but they stay within that center. So we consider that to be kind of optimal, stable care. But then you see that about half of that a big chunk of remaining kids end up in various forms of unstable care. One is that home center home category, and that means that the kid left home, at 12 months of age or whenever the parents wanted, went into a center, but then for various reasons was pulled out of that center. And the one after that is a case where that happened multiple times, so the kid was in and out of multiple centers. The other pathway is that kid went in and out of homing centers. That's that 5.9%. The other pathway is multiple centers. And because this was a research study, we were able to ask families on an ongoing basis when they made a transition, why they made it. And what we saw is that in that upper pathway, parents, often that happened because a parent went on maternity leave. So they had a second child, they lost their subsidy in childcare, the child had to be withdrawn. The other main reason they told us was for financial reasons, and often that had to do with job loss. if you look at that lower pathway, they often told us that they found better care that suited them better, whether it was because it was of higher quality in their eyes or because it worked better for their families. And that, that difference in the reasons for the instability seems to be what's related to the outcomes for the children. So that negative instability that's caused because of kind of external factors like job loss or having to go out on parental leave because of the nature of the policy, that pathway is associated with negative mental health outcomes for kids, whereas the other isn't. So it's just sort of illustration of the outcome of that policy causing instability and having then negative correlates for kids. So what does this all mean? Just tying it back together because I'm scared Jenny's going to cut me off any second. We know that the Canada-wide agreements are going to drastically increase demand for care, and that without the right policies, we have every reason to expect that low-income parents and children will be squeezed out of the market. The activity requirement can cause instability in childcare, and that can be harmful to children. I also want to point out that it's unfair because affluent families who are now going to be heavily subsidized don't have that activity requirement, and there's an inequity there. Where if you're low income, we're going to require that you have this activity requirement, whereas if you're more affluent, we don't. So I think that's something that needs to be rectified. And so what we did is try to turn to the agreements and see, do we see anything in the agreements that might lead us to think that there's an effort to mitigate some of these negative outcomes that we can anticipate for low-income families and children. And I can, spoiler alert, it's very hard to make sense of these agreements. They're very inconsistent, and part of that is the nature of our Constitution, that there's a lot of heterogeneity there. But partly it's that the information is not there or not readily available. Very hard to understand. But we did manage to kind of extract some things. One was just what are they planning on spending the funding on? And the categories, as I mentioned earlier, that we were interested in were affordability and inclusivity. You see that in the early years of the agreements, there's very little allocated to that inclusivity, which is the piece around guaranteeing that low-income families have access to spaces. The piece about affordability is a huge piece of the puzzle, not in all provinces, but in most, and it will be moving forward. The thing about affordability is that you can be talking about affordability for very affluent families there, so there's no guarantee in that allocation that the governments are planning on targeting that funding for the people who need it most. So it's useful information, but it isn't reassuring that the needs of these families are going to be addressed. The other thing we did was we just looked for discussions of subsidy in these documents, just a word count. We recognized that some provinces use different words to talk about subsidy, so we accounted for that. We looked in the documents to see how they talk about it. And what you see is that there's very, very little talk about these issues in the documents. Now, they talk about a lot of things, right? But it's somewhere in the range of less than 0.2% in most of these documents. So it's definitely not something that's featured centrally. What we wanted to present, and I say we because this is like anything else, I do a group effort with my amazing group of students who are sitting here today. No, I do feel very privileged to have the opportunity to work with these amazing people. So we sat around and we tried to understand what they're saying specifically about subsidies for low-income families. And we had tables, and we realized that they didn't make sense. We couldn't make it's like that joke of how many PhDs, does it take to change a light bulb? How many PhDs? And I don't have the table here. I wish, at some point I said, I'm going to have slides that say, tables I wanted to have for this presentation. This is one of them. It didn't make sense what we were able to get out of the documents. And maybe it's coming, but I think a talk like this, or my point is, it needs to come. We need to call for it. That information needs to be made available and to be explicit. And that's really a reporting documentation issue. And the fact that it's not there, well, maybe these are early days, but if we don't demand that it be there, it may never be there. And without that information, the don't have transparency, we don't have accountability in how our government's going to plan to address the needs of disadvantaged populations if that information is not mapped out somewhere. So there's some critical questions we have to ask. What are the provinces, territories doing about supporting low-income families? What are they planning to do if they're not already doing it? Are they allocating funding to cover the $10 per day fee on average for low-income families? Because as I showed you earlier, like, isn't the families that we see in Toronto cannot afford $10 a day? People are getting a subsidy, and also, are they going to have this work study requirement? And what is being done to mitigate that Matthew effect, where we know that the low-income folks are going to be squeezed out of the market. For high-income families, this policy has been a windfall. I've jokingly said we can study whether affluent families go to Florida or Costa Rica. I don't want to study that. That's not the policy I'm interested in. We have to think about implications for low-income families and some possible solutions as I wrap up. You know, the dream, of course, is publicly funded, community, school-based, with enough spaces for everyone. The short-term compromise is, I think we need a sliding scale, and low-income folks need to have free access to childcare, and we need to get rid of the activity requirement. Charles Pascal, who I'm glad we paused and thought about earlier this morning, made that comment, that recommendation in 2009. Until the system expands enough, both in terms of physical spaces and the staffing issue we've talked about, as a Band-Aid, we need to reserve some spaces for these folks so that they can have access. Either way, we need to improve the working conditions for ECEs, because that's a key part of the puzzle, as Arlene said so eloquently earlier. And I just want to end on a note about quality. I am a quality researcher. None of this is about quality. We're just at this point trying to figure out how we get those spaces so we can start talking about quality, and maybe that'll be the talk next year.